My name is Paul Sifry with the Steadman Hawkins Clinic of the Carolinas, a division of the Greenville Hospital System. This is an educational video for me to tell you your post-operative instructions after undergoing the total knee replacement. You've probably been in the hospital about 3 days, and hopefully you've received excellent nursing care, and hopefully you've progressed very well with your physical therapy. Upon discharge, most people will go home with home health physical therapy coming to the house, working on exercises with regards to gaining motion and working on ambulation training. Some people will go to an inpatient rehab facility for more intensive rehabilitation. The home health physical therapist generally comes 3 to 4 times per week for 2 to 3 weeks based on your progression. You will also be sent home with some pain medication and a prescription for a blood thinner. Some people will go home on aspirin. Others will go home on the medication they had used prior to surgery as a blood thinner. The main goal of the first few weeks, once you're at home, is to work on gait training and obtaining range of motion. The physical therapist who comes to your home, or the physical therapist who works with you at the rehabilitation facility, will work aggressively on achieving both full extension and full flexion. The second thing during the first 2 weeks that's very important is to keep a close eye on the incision. Most incisions will have a little bit of redness around the incision line and a little bit of warmth. This is normal. However, if the redness worsens or there becomes any drainage from the incision site, you need to call your physician immediately. Usually around 10 days to 2 weeks after surgery, the therapist will remove the staples that are holding the skin incision together. They will then place what's called steri-strips or small band-aids to serve as some extra protection. Your first post-operative visit will be at around 3 weeks after surgery. The goal of this visit is for me to inspect your incision to make sure it's healed in well, and secondly, to assess your progress with regards to gaining your range of motion. A general goal by the 3-week mark is to be obtaining full extension and at least 90 to 100 degrees of flexion. Usually at about the 3-week mark, most people have progressed well enough to begin outpatient physical therapy. I generally like my patients to go to outpatient physical therapy 3 times a week for a couple of weeks. Your next visit to me will be 6 weeks after surgery. And this visit is for 2 reasons. Number 1, we will obtain x-rays to make sure the prosthesis is well positioned and there's no intra-articular abnormalities. The second purpose of this meeting is to make sure you've achieved your range of motion goals. A general goal at the 6-week mark is to have full extension to about 120 degrees of flexion. However, this differs dependent upon the patient and how much motion they had prior to surgery. I generally will tell my patients that it is up to 6 months before you sort of have forgotten that you've had your knee replaced as the first thought when you wake up in the morning. Congratulations on receiving your new total knee replacement and becoming more active and following a more healthy lifestyle. Thank you.